We're all ready. All right, we'll start with the Public Education Subcommittee, which is chaired by Senator Hashmi. Senator Hashmi, you want to start and go through the bills and just simply say if they, let's call the roll first, all right? All right.
Mr. Chair, we have a quorum.
Okay. And if there was people, the public commented at the subcommittee, let me know because we'll just go straight to a vote. All right, you're up.
Thank you, Mr. Chair. And the first bill is SB 1225, and this is with regards to broadband services and offering the opportunity for local school boards to appropriate funds to promote and encourage the expansion and operation of broadband services for education. It allows school boards to partner with private broadband service providers, and this bill reported out of committee on a vote of 5-0, but the patron is here if there are any questions by the committee members.
All right, there's a motion to report and a second. All those in favor vote aye, those opposed no on Senate Bill 1225. All right.
Senator Barker. We have ayes 12, no 0.
All right, ayes 12, nay 0. The bill is reported. All right, next is Senate Bill 1257, patroned by Senator McClellan.
Thank you, Mr. Chair. SB 1257, patroned by Senator McClellan, is with regards to our standards of quality. It is making some changes to certain standards within the standards of quality. The first is to provide increased learning and principal mentorship, and it is also asking for mentorship programs for our teachers, and it expands opportunities for lowering the ratio of English language learners to teachers and also employing reading specialists. Many of these efforts are an attempt to reinstate the ratios where we were at prior to reduction in funding, and this bill reported out of committee on a vote of 3-0. And I move that we recommend reporting and re-refer to finance.
All right. You've heard the motion. You've heard the description of the bill.
Mr. Chairman.
Questions? Sure, Senator Cosgrove.
Thank you, Mr. Chairman. I just want the committee to be aware that Senate Bill 1257 has a financial impact to the state of $462 million.
Right, it's going to finance.
I know, but let me finish.
Right.
But that also has to be matched by the localities. So we're talking almost $1 billion bill here. So when y'all go to finance, please keep that in mind.
Mr. Chairman.
We're aware that it's a big ticket item. All right. You've heard that. Are any more questions?
Mr. Chairman, just briefly.
Senator Newman.
I know that Finance is going to hear the financial aspects of this, but to be very clear, we have been in Senate Finance in the Public Education Subcommittee pulling restrictions off. We've been putting more money in through the lottery way and not through the SOQ way to give localities more autonomy on these items. This is exactly the opposite. I know it's well-intentioned and these are good goals, but when you put it in the SOQs, you end up doing the opposite of that. So I'm going to vote no, and hopefully Senate Finance will also look at that, sir.
Okay. All right. All those in favor of reporting and referring to Senate Finance, vote aye. Those opposed, vote nay.
Ayes 7, noes 5, abstentions 1.
All right. Bill is reported 7-5 to 1. Okay. The next bill is Senator Donovan's requiring the Department of Education and Board of Education develop various policies and procedures. Senator Hashmi,
Thank you, Mr. Chair. SB 1288 reported out of committee with a line amendment on a vote of 5-0. The amendment is available on LIS. And I did want to share with the committee members here, this particular bill requires that the Department of Education and Board of Ed develop new policies and procedures and modifications to the existing policies that we have for special ed. I have heard from the Virginia Council of Administrators of Special Ed. While they are not opposing the bill, they do have some concerns with it, primarily in terms of the critical shortage of local funds with limited state support in special education. So they have some concerns about the bill, but we recommended reporting with the amendment on a vote of 5-0, and I so move.
all right, you've heard the bill, you've heard the
Mr.
motion.
Chairman.
Questions?
Yes, there is a
Senator Donovan.
Thank you, Mr. Chairman. There is a substitute for this bill between committee and now, with recommendations from Holly Coy to facilitate the process of DOE developing the guidelines to, and it was mostly just technical adjustments that were made by her, Mr. Chairman.
Do we need amendments?
We have a substitute.
I can't hear you through there.
We have a substitute.
Okay.
I move
Yeah.
the substitute, Mr. Chairman.
All right, there's a motion and a second to adopt a substitute to Senate Bill 1288. All those in favor say aye.
Aye.
All right, substitutes before us. You've heard a description of the bill.
Mr. Chairman, I recommend reporting of SB 1288 with the substitute.
Second.
All right, motion and a second to report Senate Bill 1288 with a substitute as amendment in nature of a substitute. All those in favor vote aye. Those opposed, nay.
Ayes 14, no 0.
Ayes 14, nay 0. The bill is reported. All right. The next is child care background check portability. Senator Hashmi.
Thank you. SB 1316, patroned by Senator McClellan, is asking that we have the ability for background checks to be portable with our child care providers, and it exempts our prospective employees and volunteers of certain child care facilities from statutory background check requirements if the individual has completed the check within the previous 5 years. This is a subsidy pilot program, and there was a line amendment that is available on LIS. This bill reported out of committee with the amendment on a vote of 3 with one abstention, and I so move.
All right.
Mr. Chairman,
Senator Hale.
it needs to go to finance.
Pardon?
It needs to go to finance.
Okay. I do have a question. Let's suppose there's 3 or 4 parents that are rotating, watching the other kids, before and after school, one day, one the next, but there's 3 or 4 kids involved. Do each of those parents have to undergo a background check?
Mr. Chairman, this is, I think what you're describing is a small group parental co-op, and that doesn't necessarily fall under the guidelines of a child care provider, a formalized system.
That question was, if somebody brought that up, okay? All right, you've heard a description of the bill. It has to go to finance if it's reported out. Is there a second to the motion?
Second.
All right, it's been moved and seconded that Senate Bill 1316 be reported and referred to finance.
Mr. Chair, there are amendments on this.
Pardon? Yeah, there's with amendment. All right, all those in favor?
Can we move the amendment, Mr. Chair?
Move the amendment. I move the amendment.
Oh, I thought it was adopted okay.
Second.
All right, you've heard the motion for the amendment. All those in favor say aye.
Aye.
Opposed? All right,
Move to report
Mr. Chair,
as amended.
as
to
amended. Okay.
Mr. Chair, I'd like to ask a question once you,
It is.
Senator Superline.
Mr. President, or Mr. Chairman. I'm trying to understand the background check variance. So are we providing for, if we know that a background check had been done 5 years earlier, we are waiving it?
No.
It's been done within the last 5.
Mr.
And there's less than 180-day separation from your past provider-type job, I guess.
Mr. Chairman, and probably the chairman of the committee can speak to this, but the background checks will be reserved at departments depending upon the employment of the individual, either the Department of Education or Department of Social Services, which will be able to then provide verification of that background check to a new employer. So there is a check and balance system in place. It just reduces the cost for those child care providers who might have to pay for their own background check when they seek employment. So it's actually good for the provider, for the employees.
Well, I would think it would always be good for the potential employee not to. I think it would always be good for an employee to be able to possibly avoid any background check. What I'm trying to understand is the how much avoidance is happening.
But it also saves the employers, and as we all know, there is such a small margin on child care providers, and so for them not have to pay $250 or $500 for a background check is a huge savings. But there is verification and there is documentation. It's not just somebody saying, I have it. We will have agencies that verify that and state that the individuals are in good standing. If I'm incorrect, I'll defer to the chairman of the committee.
Senator Donovan is correct. It is simply making the background check portable so that when an employee goes from one agency to another, their background check accompanies them up to 5 years.
Are there any more questions? All right. Those in favor of reporting and referring to finance, vote aye. Those opposed, nay.
Ayes 12, noes 1, abstentions 1.
All right, the bill's reported and referred to finance. All right, the next is Senate Bill 1317, that's Senator Donovan, open enrollment policy.
Thank you, Mr. Chair. SB 1317, patroned by Senator Donovan, asks that we have open enrollment policy. It's requiring all school boards to establish and implement policies to provide open enrollment for any school of any student who is eligible to receive free and reduced lunch upon the request of a parent or guardian. There was some discussion around this bill. We did hear public testimony from the superintendents and the school boards who were in opposition to it. We also heard from many parent groups and parent advocates who were very much supportive of this policy. This bill reported out of committee on a vote of 4 with 1 abstention, and it was recommended for reporting on a vote of 4 with 1 abstention, and I so move.
Just a question. My county, as an example, Fairfax, has 50-some thousand students who would qualify for this. I mean, did anybody bring up the fact that you'd have absolute chaos if they were all, if you had this switching around?
Mr. Chairman, the school boards and the school superintendents spoke to that. They were strongly in opposition to this bill.
Mr. Chair.
Peterson.
Peterson.
Senator Peterson.
I would simply say you've got chaos right now. Right now, you've got all those kids you're talking about are in front of computer screens anyway, so I'm not quite sure what the difference is at this point.
Well, we're not always going to be in a pandemic. That's the difference.
Mr. Chairman.
Senator Donovan.
Thank you. I want to point out that this opportunity for those with free and reduced lunch qualifications is embedded in pre-existing Code of Virginia that puts checks and balances in place so that schools do have the ability to control enrollment in each school. It does not require the schools to provide transportation, so it won't be chaos, because ultimately schools, we already have guidelines in the code to allow students to transfer if their parent is an employee of that school or for other reasons. This just gives another parameter by which, and when you look at the data, and that's what we spent a lot of time in subcommittee on, about really finding ways to improve opportunity and equity in education, being forced to go to school in a zip code that you live in when you don't have the capacity to move to a better school district is perpetuating systemic poverty and generational poverty. So this doesn't overwhelm the schools, but it does give a chance for parents to have an opportunity to have a say in their kids' future opportunities. I hope the committee will see fit to pass the bill.
Mr. Chairman,
Senator Cosgrove.
I don't usually disagree with my colleague from Henrico, but my school district basically sent me some information. You know, basically, schools already have the authority to do this. This now becomes a mandate. And the real apocalyptic question is, we have some schools where every single student is eligible for either, free or assisted lunch.
Right.
So if we think it's political here, try getting into PTA or schools and that kind of thing. What happens if an entire school wants to move? How is the school board and the school system not going to be overwhelmed in that unlikely situation, but it could happen?
Mr. Chairman, I would point out that it would create competition within the school division. The children aren't all going to be able to move because there are stopgaps in place to make sure that schools aren't over capacity. But it will create competition and an awareness of opportunity, which cannot possibly be bad when parents don't have the opportunity to move their kids out of a school district. So I would further say, as we said in committee, if this is not mandated, this only says that they have to develop a policy. It doesn't, it very clearly says that, that I'm trying to find the line, Julia, you pointed it out to me before. A random, unbiased selection process in the event that open enrollment requests exceed the capacity of a school. So they have the checks and balances in place. But this is a way, why are we committed to kids going to school in a zip code when we have such prevailing evidence that zip code designations are what contribute to bad social determinants of health? We have to start providing opportunities and thinking a little differently if we're going to change the trajectory. I hope you'll support the bill.
I'll tell you why. Because it's not that the schools are bad. You look at the schools on test scores throughout Fairfax County. The wealthiest areas where both parents are college graduates, the kids have been to nursery school starting at age 3, have had tutors, have had everything going for them, okay? They operate at a tremendous advantage over kids that come from poor areas. It's not the school. The same textbooks, okay, and highly qualified teachers who teach at the schools that neighborhoods feed this are just as qualified and just as good as the ones who are teaching at McLean High, Langley High, and that. They're not better teachers. They're not that. They're getting kids that come from a very wealthy environment, and they're doing extremely well as a result of that.
Mr. Chairman, all boats rise with a rising tide. Children being in that environment give them the opportunity to compete and perform better, and we know that's true. And I would simply say, you're right. You're talking about social determinants of health. It has to do with safety and whether they have good nutrition and what many other determinants that affect their opportunity to succeed and achieve. But that doesn't mean we don't need to start changing those opportunities and those social determinants of health, because if we keep things the way they are, it's never going to get any better.
Well,
this is not an overwhelming...
I'm not going to have a running debate with you. They got a charter system in the D.C. public schools The kids who've come from well-to-do homes, they're doing great in those charters. The kids that have not don't do anywhere near as well. It's a problem that we have to attack when these kids are 3 years old. All right, you've heard this. Any more questions?
Just one comment. Mr. Chairman, it said that this is not a mandate, but looking at the FIS, it says it requires all local school boards to establish and implement policies to provide for the open enrollment, et cetera, et cetera.
But,
That's my biggest fear
All
of
right.
the bill.
and then, Mr. Chairman, Peak back here, Peak. And I guess question to the patron, Senator. I mean, it says shall. The first line is may for all students, and then your addition says it shall for underprivileged. I mean, it is a specific mandate to all localities, isn't the way I read it.
All right, we spent a fair amount of time on this bill. I think we understand it.
Mr. Chairman, if I could respond to that, because the point's been made twice. Let me be very clear. They shall establish and implement policies. The policies are protected by the numbers underneath it, which include them being able to control for the volume of children that go to a particular school based on the criteria that they have to not exceed capacity. Does not say they have to move the children. This is an opportunity.
Okay. All right,
Mr. Chairman,
Senator Howe.
I'm supporting this bill, and I think it's backed by study after study that shows that lower income students benefit from being in a diverse situation, but so do higher income students also benefit by the diversity that they experience in the public schools. So I am going to support this
Okay.
bill.
All right, there's a motion to report and a second. All those in favor of reporting Senate Bill 1317, vote aye. Those opposed, nay.
Mr. Chairman,
Ayes 10, noes 4.
Ayes 10, noes 4. The bill is reported.
Mr. Chairman, fully aware I risk making you angry. I just want to point out that I think Senate Bill 1288 needed to be re-referred to Finance. It's the JLARC one.
I asked Senator Howe that. She said no.
It's not on the list staff sent.
Okay.
All right. Next is Senate Bill 1357.
Thank you, Mr. Chairman. SB 1357, patroned by Senator Donovan, is addressing the need for competency assessment. It's directing each school division to develop and administer a fall and winter diagnostic assessment, as well as a spring growth measurement assessment for each student to assess their competency in each core subject as determined by the DOE. We had considerable conversation about this bill as well, and DOE indicates that they are in a position to begin to address the needs of these diagnostic assessments as well as the growth measurement assessment. This bill reported out of committee on a vote of 4 with 1 abstention. The committee recommends reporting, and I'm sorry, I should have moved the substitute first. So there is a substitute, and I moved the substitute.
All right. You've heard the bill. There's been a motion and substitute. Is there a discussion?
Shall we vote on the substitute?
Has the substitute been adopted? Was it adopted?
Not in committee. So.
Need a motion to adopt the substitute?
Move the substitute, Mr.
All right, with motion and second to adopt the substitute, all those in favor say aye.
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 Opposed? All right.
Mr. Chairman, I recommend reporting with the substitute and re-refer to Finance.
All right, you've heard the motion and a second to report and re-refer to Finance. That's for Senate Bill 1357. All those in favor vote aye. Those opposed, nay.
Ayes 14, no 0.
Ayes 14, no 0. The bill is reported and referred to Finance. All right, Senator Hashmi, you got two more left, 1401 and 1439.
Thank you, Mr. Chairman. SB 1401, patroned by Senator Pillion, is reducing our SOL assessment requirements to the federal level as recommended, and it requires DOE to report on the estimated projected and actual savings as a result of the implementation of the bill. This bill had strong support from many advocacy groups as well as from VDOE, and the committee recommended reporting on a vote of 4-1. We recommend reporting and re-refer to finance, and I so move.
Mr. Chairman. Newman.
Senator Newman.
Mr. Chairman, bills have been coming forward for a very long time, and I get it. Those people that are in the education community wants it. I just think it's a terribly irresponsible thing to do, to reduce our standards down to whatever the feds say. If the feds tomorrow decide that they're going to have no standards, we will have no standards tomorrow. We've devastated our standards of learning in this Commonwealth. The last 2 years, there's been a direct assault on social studies. That assault, in my opinion, was appalling. We basically have gone away from direct measurement on social studies. We should not have done it. All we have left now is math and English. That's it. There's not a horde of tests that are going on. There are very few tests. They're the basics of basically English and math, and you have a provisional type, an item of science that's not worth much. I just think we're giving up, and I appreciate that this banner has been carried by some, including the Washington Post, that says Virginia's going to pay for this, and we are going to pay for this. We think that not having assessments is a good thing, or going to a federal absolute minimum, which could go away tomorrow, is a good thing. You just keep going. I think we're going to pay for it in SAT standards. We're going to pay for it in the long run. I've been fighting this battle for a long time, and here comes the bill that really is just a home run on anti-accountability.
Mr. Chairman. Cosgrove.
Senator Cosgrove.
May I ask counsel a question? May I ask counsel?
Sure.
Thank you. Senator Newman brings up the point that should the federal government decide there would be no more testing, under the way this bill is written, would we still have to adhere to the Secondary Education Act of 1965 as amended, or would it all just go away?
Mr. Chair, Senator Cosgrove, I believe that we would, if the federal government decided that it would go away, then we would have no SOLs.
I missed
We would
that.
not have SOL tests.
Okay.
If the federal government determined that they weren't required.
All right, thank you.
Mr. Chairman, Senator Pillion back here. So this is already being done through the temporary waiver. The administration is already doing this, and the Department of Education announced that it would grant these waivers to SOLs and do local assessments, and that's what they've been doing. We currently have 27 SOL tests. We're still going to have 17. The sky's not falling. We're going to still have 17 SOL tests. So this will put the testing back to the local school boards, back to the local school systems, which I think is the best thing.
Mr. Chairman.
Senator Newman.
Could I ask the senator a question? I guess, Todd, my question is, what is the metric that we're going to be able to determine how the city of Petersburg, the city of Lynchburg, and Wise County are doing on the local assessment? What's the statewide metric? How will we know how a locality is doing?
I believe that the DOE has its standards already in place.
Mr. Chairman, I appreciate that. And I didn't mean to put the gentleman.
That would compare different school systems.
Right. Mr. Chairman, I think the answer is that we will not. And I know I've been striding about this for a long time. And here again, I think the Washington Post just plain gets it on this one. The fact is we will not know. We have measurements today that Petersburg has struggled, and we have stepped in and helped them because we know. If we do this, and if there's a change in the federal, right now we only know a couple things. We only know English and math. If we do this and the feds change, we will be blind. The Constitution of Virginia says we're supposed to have free, public, and quality education, and I think we're losing the quality piece.
Well, a little more flexibility probably by the state wouldn't hurt. I just give you a hometown example. They have the kids at Jefferson, the science high school, continue to take these tests on schedule, all the tests. Since they started the SOL, that school has consistently been at 100% on math, 100% on science. In other words, the top in the state, and the lowest score percentile, they're in the 97th percentile in social studies. Why they continue to have them keep taking these tests when it's obvious how they're going to do is beyond me. But
I think Mr. Chairman, I think that a lot of those schools are exempt through the innovation portion today, but I know Senator Pillion, and I know his heart is right and wants to do the right thing. I've been fighting this for a long time, and I just think standards actually matter, and we're going to pay for this in the end. So I'm done.
Mr. Chairman.
Senator Hashmi.
Thank you. I understand that this is a subject that's fraught with a lot of challenges and difficulties. We absolutely need to have certain metrics by which we can assess how our schools are performing, how our students are performing. I know from many educators and myself as an educator that SOLs are simply not providing that full assessment of student competency, student learning. They don't really deliver what we need to have our students focusing on areas of critical thinking, critical writing, being able to analyze and develop those essential skills. Many educators are advocates of reducing SOL. And I know that if we are going to take away one opportunity for assessment in education, we are working to craft other and better metrics for assessment of student learning. And the committee recommends reporting on a vote of 4-1. We refer to finance.
We're not going to do it? Okay. All right.
Mr. Chairman, just one more short comment.
Sure.
All right, looking at the FIS, and normally I support making it easier on the schools, but I share Senator Newman's concerns, especially seeing what is going to be eliminated. The second one down is civics and economics. And, in a time when you ask most high school kids what the three branches of government are and they can't answer it, I'm a little concerned about
Neither
that.
could that guy that just got elected to the U.S. Senate from Alabama.
Yeah, well, neither could the president. Yeah, the president, and that thing. So
And let me remind you, we have SOLs in place right now. So if we can't answer that question now, obviously something's not working.
Mr. Chairman. And I think we all are trying to get to the same conclusion, and that is that we have a way to measure our kids in our schools against our standards without having intimidating tests at the end of the year that teachers feel compelled to teach to so that they've lost their creativity and their engagement in the subject. I believe that we need to have standards that are set by the Department of Education in order to accomplish that, as opposed to the localities. And I think that's how we stay true to our principles of SOLs. The bill we passed, 1357, has DOE develop the two diagnostic tests and the assessment at the end, but they are literally using the SOLs and disassembling them so that they are less intimidating tests that actually look at student progress, but don't create the inconsistency of different localities choosing different tests, some federal, some state, some who knows what. So I agree that we need to decrease these end-of-the-year SOLs, but we still need to measure our kids. I just don't think this solution of turning it over to the localities stays true to our commitment to quality measure.
Mr. Chairman?
Senator Edwards.
Yeah, I've been critical of the SOLs from the get-go. Teachers tend to teach to the test. They crowds out electives. There's a lot more to education than whatever's on the SOLs, whether it's 2 or 5 or whatever it happens to be. I think the fewer we have, the better. Now, in terms of standards, I agree. The state, well, there's some national standards, of course, SATs and other things like that, which we need to look at. But I think we're in the right direction of reducing the number of SOLs. I don't think it's helped us hardly at all.
All right, we've discussed this quite at length. I think everybody knows what the bill is about. I don't think this has to go to finance, does it, Senator Howe? Yes, it does. It does? Okay. All right, the motion will be to report and refer to finance. All those in favor of reporting and referring to finance, Senate Bill 1401, vote aye. Those opposed, nay.
Ayes 9, noes 5.
Ayes 9, noes 5. The bill is reported and referred to finance. Okay. All right, the last bill and the education subcommittee is Senator McClellan's 1439, Guidelines on Excused Student Absence, Civic or Political Engagement.
Thank you, Mr. Chair. SB 1439 was patroned by Senator McClellan, and it was also brought forward to Senator McClellan by a group of students who are seeking to really expand their civic and political engagement. I think this is a nice corollary to our previous discussion with Senator Pillion's bill about helping students understand the civic process and how they can really be engaged with political activity. The students made a point of stressing that this was a bipartisan bill. They were both Republican students and Democratic students, self-identified, but they worked in collaboration and cooperation to present this bill. They are asking that in the list of excused absences, that an absence of 1 day or a half day to participate in a civic or political event be granted as an excused absence. The committee recommended reporting on a vote of 4-0, and I so move.
Mr. Chairman, question. I guess to the chair of subcommittee, is there any definition anywhere of a civic or political event that you're going to be given excused absence for, or is it left up to the student or kind of their First Amendment to determine?
Mr. Chairman and Senator Newman, thank you for that question. I would ask council, do we have a definition of civic and political event?
Mr. Chair, Senator Hashmi, there is no definition of that in this code section.
Mr. Chairman, so the question, I guess, would be to the chair. I'm sorry, she's kind of standing in. Is if a person decided on exam day that they wanted to go attend a civic event, is that going to be allowed? It doesn't appear to be that the school can put any four corners around this. Could the student decide to, if they didn't do their homework, to attend a civic or political event since there's no definition?
Mr. Chairman and Senator Newman, I don't have the answer to that question, I'm afraid, but it looks like our council does.
Mr. Chair, Senator Newman, the beginning of subsection J says subject to...
Can you take your mask off? That way we can...
Subject to guidelines established by the Department of Education. So I think the department could put some four corners around what would be acceptable and not.
Is what?
Madam Chair, sorry. Mr. Chairman, I think what she's saying is that the department in J could put some parameters around it. Mr. Chairman, I would hope that we would put parameters around it. I don't know if they will. And boy, how devastating the local schools would be that if you decided you didn't want to go to school, you could just go to anything civic. And so We haven't done this in the past, but I would hope that we wouldn't do it, and at the very least, that we would put some parameters around it.
Mr. Chairman, question.
Senator Cosgrove.
Thank you, Mr. Chairman. Members of the committee, I'm looking at the text. I haven't seen it, but is there a number of days that this can be done? Is it 1 day, a half day, or is it 10 days, or is it?
Mr. Chairman, Senator Cosgrove, there is no day number set out in this bill.
Thank you.
Mr. Chairman, Dave Suderline. Mr. Chairman, this bill is very interesting to me, especially being in the room with Senator Peterson. I spent a fair bit of my time in high school knocking doors for an unsuccessful candidate against Senator Peterson in his House of Delegates race. And I didn't probably spend a lot more time on that than I did on my schoolwork sometimes. And I'm pretty confident that on a day I wasn't going to do well on a test at Robinson High School, I would have found that was a very important day to door knock and sideburn precinct that surrounded, because that was just the day we needed to make it happen. Most school districts have Tuesday off on Election Day now. Primary day is off, and a lot of places have the day preceding Election Day. I just think that if this policy were in effect when I was in high school, Senator Peterson still would have won, but I would have done even worse in school.
Mr. Chair.
Senator Suderline, sideburn used to be in my district. You weren't the one tearing down my sons, were you? Senator Locke.
That was me.
Does it not say in the legislation itself that guidelines are going to be established by the Department of Education?
Mr. Chair, Senator Locke, that's correct.
So I assume that there will be some parameters established, that they're not just going to willy-nilly go out here and decide, you know, I'm going to attend some political event or engage in some civic activity on my own, that there will be some guidelines established as to whether or not permission will be granted to the student prior to them engaging in any activity.
Mr. Chairman, question for council. Is it defined in code how many days you may have an excused absence in a year?
Mr. Chair, Senator Donovan, I believe that it is defined in code. I don't know the number off the top of my head. If someone from DOE is on and wants to answer that question. But yes, I do believe it is outlined in code.
And Mr. Chairman, just follow-up comment. And I don't know if this is DOE policy or not, but I'd be interested to hear. When my children were in school, an excused absence could not be obtained after the fact. An excused absence had to be applied for and approved before the event. So if they were interviewing for school, college, they had to get that approved ahead of time, but you couldn't have an excused absence if it was after the fact.
Mr. Chairman.
By the way, it says in the bill itself, subject to Department of Education guidelines. So, I mean,
Yeah. Mr. Chairman,
pardon?
I'm in your queue. Okay. To comment on the bill. Why do we want to put this burden on the Department of Education? Because you know, and I know, when some kid or group of kids comes in there and says, I want to take off so we can go to the MAGA Stop the Steal rally, or I want to go to Gun Lobby Day and put those kind of pressures on, or I want to go see this group that some groups say are a hate group, and put this pressure on our Department of Education to make those determinations. And I appreciate people having civic involvement, but this will be a nightmare for our DOE or for our school divisions to determine what groups are acceptable, what groups are not acceptable.
Mr. Chairman.
By the way, my understanding is the City of Falls Church lets the kids 1 day. I don't know what day it is or what, but,
Can't hear you, Mr. Chairman.
all right. Senator Edwards? All right. You've heard the bill. The bill's been thoroughly discussed. Is there a motion? Senator Howe, you need this? Okay. There's a motion to report. Is there a second? All right. You've heard a motion and a second to report Senate Bill 1439. All those in favor vote aye. Those opposed, nay.
Ayes 7, no 7.
Bill is not reported. All right. The next bill, Senator Donovan has requested that we bring up Senator Bagby's bill, which is identical to hers, and I'll get to you next. Okay. This is her bill. Senator Bagby's bill is pretty much along the same lines as the emergency type bill that we passed with Senator Donovan. Senator Donovan, you want to?
Thank you, Mr. Chairman. Yes, his bill is my bill. Paragraphs moved around. Our bill, paragraphs moved around. There are a couple of additions about data processing, which is data processing that the Department of Health is already doing, and a couple of permissions. If you look at his bill on lines 60 to 65, where it basically says that an LPN who is administering may do so without supervision. I think, we can discuss that, but basically everybody in the center is going to be supervised. Oh, thank you. Mr. Chairman, I do have a substitute for this bill.
Mr. Chairman, Delegate Bagby is on the Zoom call for any questions.
There we go. Delegate Bagby.
Delegate Bagby, you want to present your bill?
Yes, thank you, Mr. Chair. And the senator was doing a fine job, and so I appreciate that. And Mr. Chair, I also want to point out that Medical Society, MSV, is with us today. DDH is with us. Members of the administration are with us. All individuals had a part in crafting this legislation. It is a quite similar, and the bones of it is what Senator Donovan laid out. There are quite a few differences associated with this piece of legislation, but the three main goals remain, and that's removing the barriers to allow health practitioners and students to volunteer to administer the COVID-19 vaccine, allowing for the creation of the vaccination sites, requires a data collection to ensure an equitable vaccination program, and that's the part that I am most excited about. But there's about 8 to 10 things in this legislation that is a bit different. And again, it adds language to ensure reporting of race and ethnicity data into the Virginia Immunization Information System. It explicitly states that the process for volunteering as a vaccinator is only for the duration of the public health emergency. And it also provides stronger liability protection language for entities overseeing vaccination administration. And again, Mr. Chair, there are individuals, if you would be so kind to allow them to share, because of course I did not do this alone. And it was the work of you all in the Senate, the work of our HWI committee, the work of the administration, VDH, and Medical Society of Virginia.
Are there any questions of the paper? Okay. Stay online just in case, okay? Delegate Bagby.
Mr. Chairman, there are a couple of amendments that I'd like to propose, and I think it's actually an amendment in the form of a substitute. I'm so sorry. Is that correct, Council? I have an amendment in the form of a substitute, and I'm happy to speak to that substitute. When we look at the bill from Delegate Bagby, on line 109, this is referring to localities with emergency medical services and fire departments. There have been requests from several localities that we strike the language that says employing full-time non-volunteer emergency medical technicians or paramedics, and it would read fire departments, emergency services departments, comma, rescue squads may establish. Many of the localities have volunteer robust programs, and they want to have the ability, they're already vaccinating, and they don't want to be excluded from that understanding. Second, Mr. Chairman, I think we have an amendment that would go per council somewhere in paragraph 3.
Mr. Chair, can we take up the first one?
He would like to speak to the First Amendment, Mr. Chairman.
So are you. Turn on your microphone.
Go ahead, Delegate Bagby.
Thank you. And I appreciate the Senator's amendment because we had some discussion about this in our when we presented this bill to HWI, and the experts in the room, along with counsel, advised us that those individuals that Senator Donovan just laid out are included in this legislation. They are just included in a different section. And so I don't know if your council or the administration or VDH could speak to it to make the senator comfortable with the language that's already in the legislation.
Mr. Chairman.
Senator Donovan.
Yes, familiar with earlier in the legislation that emergency personnel are free to give the vaccine. This particular subsection refers to localities, and the localities that have volunteer rescue instead of fully employed have requested that the language reflect that those localities are included and empowered to set up these centers at volunteer rescue squads in addition to fire departments and emergency medical services, and the prior language would not address that opportunity. And again, there are already localities that are working on that, and they are concerned that if we do not remove that language, that it will jeopardize their ability to vaccinate in their localities.
All right.
Next amendment, I'll have council read, Mr. Chairman. One of the most important things that we got from MSV and from the nurses and from providers across the state is that they did not understand how to volunteer. And I think the Senate version of this bill is much more prescriptive in how that will be made accessible to them. It's much more general in the House version. And I think that it's, having gone on the site myself to try and figure out how to volunteer, it's a big obstacle. And so to make it easy for all of these newly liberated volunteers to be able to participate, I think there's some language that we want to include directing Virginia Department of Health making that visible. And I'll defer to council on that.
Mr. Chairman, Senator Donovan.
Take your mask down.
Sure. I will be honest, I didn't draft this, so I'm not exactly sure if I'm going to be talking about what you're talking about, but you can correct me if not. On line 33 of your substitute, we added that to facilitate volunteering, the department shall place a volunteer link on its website's homepage in the same visible location as the other links, such as Get COVID-Wise, to make the process to volunteer as a healthcare provider easily accessible.
Yes, Mr. Chairman, that's the proposed component of the substitute.
All right.
I don't know if the patron has a comment on that.
Delegate Bagby? Here.
I don't.
Okay. And there's only one more, Mr.
I have concerns with them, but I will allow you all to move forward in the fashion that you all see fit.
Okay.
And Mr. Chairman, there's only one other proposed amendment, and that is that on line 13, where it says whose license and certification is in good standing or was in good standing with the last 10 years immediately prior, we've had a request to make that 20. I can assure you, nurses that are trained to give injections are fine to continue to do that, and there are a lot of nurses out there that have reached out that have maybe been mothers for a long time, but are willing to be part of this workforce to vaccinate. So 20 would be the last amendment there.
What would
Mr.
your
Chair.
amendment read?
It would read that good standing within 20 years immediately prior to lapsing.
So you're changing 10 to 20.
Yes, sir.
Okay. All right, you all have heard the amendments.
Mr. Chair,
Delegate Bagby?
I appreciate that amendment. I believe you Senator Donovan's initial legislation had 5 years, and we made it 10, so 20 would be appropriate.
I couldn't. He's good with it. He's good with it. Okay. Delegate Bagby seems to be fine with that.
So, Mr. Chairman, I move the substitute.
All right, so would now have to be a substitute.
All right, second.
All right, there's a motion and a second to adopt the new language as a substitute. All those in favor say aye.
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 Opposed? All right, the substitute is now before us. Is there a motion to report?
Mr. Chairman, does that have to go to finance?
This
No. No.
Senator House says no.
Mr. Chairman, I move we report.
Second.
All right, there's a motion and a second to report House Bill 2333 in the form of a substitute. All those in favor of reporting vote aye. Those opposed, nay.
Ayes 15, no 0.
Ayes 15, no 0. The substitute is reported. Okay? I want to go back. It's reported, Delegate Bagby.
Thank you, Mr. Chair, members of the committee.
On 1439, I voted on the prevailing side since it didn't get reported, and I would move to reconsider the vote on 1439.
Second.
All those in favor say aye, or vote aye.
Aye.
Open the roll.
Oh, I think we have to a recorded vote. We need a recorded vote. This is a motion to reconsider the vote on 1439. All right, the bill is back before us.
Ayes 14, no 0.
Ayes 14, no 0. Senator McClellan, you're up.
Thank you, Mr. Chair. I understand the bill has been explained and there was some concerns raised, so I wanted to have the opportunity to address those concerns.
I'm sorry, I can't understand a word.
Yeah, can you take your mask down?
I would rather not take my mask off, but how's this? Is this better?
Yeah.
Okay. I understand the bill has been explained and that there were some concerns with it, so I'd like the opportunity to address those concerns and see if there are any amendments that could alleviate those concerns.
The vote's now, just take it.
The concern was, I think, mostly that it would create an extra burden on local governments, local school boards. The policy in the bill I noted was would the guidelines be established by the Department of Education. And one of the questions came up, let's suppose there was a test. Could they, use that as an excuse to get out of the test? Other was they wanted to come to a gun rally or something like that. Those were the questions that came up, Senator McClellan.
Mr. Chairman, I think one thing might be, it says civic and or, I'm not in front of it, political. I think the term political is ultra broad, maybe if it's limited just to civic events.
I would be open to that amendment, Mr. Chair.
Mr. Chair.
Delete political.
Is our last meeting? The next one is the day before crossover.
Chair.
Peterson. Senator Peterson.
And I'm happy to second Senator Edwards' amendment. I think that would probably narrow the scope some.
Didn't hear.
I'm happy to second Senator Edwards' amendment. I think that would narrow the scope.
Delete
We just
political
delete
online.
political.
Yeah.
What?
Delete
Political. Sorry.
So it only covers civic.
Just civic.
Mr. Chairman. Mr. Chairman, if I could ask a question, sir.
Civic engagement, okay.
Mr. Chairman.
All right. Senator Newman.
Mr. Chairman, I think that does solve part of the concern. I think civic's still undefined, and I know the Board of Education will work on it. I'm not going to vote. I'm not going to vote for it. I think it's got problems, but if it does get out of here, I hope that some in here can work on the bill and put some four corners on it. And it might be that we need to say something like that you put in your notice a certain time ahead or something like that, to where it's not just even for civic reasons you decide that you're not ready for the test. And I know that the board is going to do things, but once it leaves here, it could look just like it is now. So I'm going to vote no. I'll be very, very upfront with you about it. But I think there are other four corners that could happen. I was going to have the bill go by for a day to work on it, but I understand this could be our last meeting, and I don't want to do that to you. So anyway, that's my comments.
And Mr. Chair, I am perfectly happy to come up with an amendment that would limit this to the student has to provide advance notice. If necessary, I'm willing to define what a civic event is. The point here is to allow students to participate in official government activities that may occur during the school day. We have seen a dramatic decrease in civic engagement among young people, and particularly just a lack of faith in their voice mattering in government. And I think that's dangerous. And the fact that we've had teenage Democrats and teenage Republicans come together on a bill to try to address that, I'm willing to make whatever amendments I need to move that, to make this tighter.
Okay.
Move to report.
Do we adopt the amendment?
Move the amendment.
All right. There's a motion and a second to adopt the amendment, which would confine it to civic engagement. All those in favor, vote aye.
Aye.
All right, it's back before us again.
Move to report.
All right, there's a motion to report. Is there a second, as amended? Is there a second? Second. There's a motion and a second to report as amended. Senate Bill 1439. All those in favor, vote aye. Those opposed, nay.
Ayes 10, noes 5.
All right, ayes 10, noes 5. The bill is reported as amended. All right, we've now go to Senate Bill 1149. That's Senator Kiggins. That's nursing home standards of care and staff requirements and regulations.
Mr. Chairman. Mr. Chairman, this is the bill that I talked to the chair about, and she was going to recommit it back to subcommittee so it could be heard. Did you know about that, Senator?
I did not. So,
Mr. Chairman, we had a conversation with the chair. She talked to Senator Barker, and I think they were going to send it back to a subcommittee because of some concerns about the industry on the ability to hire. Would you mind, Mr. Chairman, if this goes by temporarily? I think Senator Lucas will be back soon to kind of talk about that.
What we can do, but one of the problems, I think, that crossover is next Friday, I think, and we would be meeting on Thursday. The bill wouldn't get to unless we got it to the floor, and B, waived all the constitutional readings.
Mr. Chair, I mean, if I have a say in it, I'd rather have it heard today just because we have all of our speakers lined up. We had to cancel last Tuesday and reschedule, or this past Tuesday, and reschedule for today. from both sides.
Mr. Chairman, I think that there is a desire to have it heard. I wonder if it could do, I think what the chairman, and I'm representing her correctly here, was going to have it let Senator Barker's subcommittee look at it. And then if she did that, maybe Senator Locke could tell us, but I'm sure we could have a meeting at the desk if they recommended it. But I think we need the detailed information that's going to come out in subcommittee on this bill.
As far as I know, all the industry people are here to speak as well. We've lined up multiple speakers on both sides. Again, this is the second time that we've arranged for them to speak. I can explain the bill, and I mean, I'd still like the bill to be heard today, but it's your choice. Thank you, Mr. Chair. There is a substitute for this bill that I want to make everyone aware of that includes a delayed enactment clause at the end and has a waiver for facilities that are not able to comply, and then also adds a training piece about infection control. So that's the change in the substitute. So I'm here today just to talk about nursing home staffing ratios, Senate Bill 1149. I'd like to start out just reminding everyone about a newspaper article that was written the day after my similar nursing home staffing ratios bill was heard in the same committee last year. To quote the Daily Press, brushing off for the 16th time a proposal to set minimum staff levels for Virginia nursing homes, which are ranked among the nation's worst for the number of patients per caregiver, a state Senate panel decided to recommend a study group instead. Well, I sat on that study group, as did many of the voices we will hear from today, for many months over the summer. We discussed solutions to nursing home staffing recruitment and retention and came up with 35 recommendations, 3 of which I proposed as bills this session, and the 4th, which brings us here today, staffing ratios. I also sat on the Governor's Long-Term Care Task Force since the beginning of the pandemic, which focused on addressing PPE shortages, testing deficiencies, staffing shortages, and now vaccine distribution. The issue of inadequate staffing has been at the forefront of many meetings, discussion, media stories, and constituent emails for almost a year now. Last year, almost 3 months after my bill was turned into a study, we saw over 50 deaths in one nursing home in Henrico County occur over a 2-month period, where the medical director, Dr. Jim Wright, who we will hear from today, was faced with staffing shortages that caused he and his physician wife, who did not work at the facility, to take up daily care and feeding of residents due to staff who could not keep up with the needs of patients or who could not come to work because of their own health. Many of these same staff work at multiple facilities to make ends meet for their families due to low pay and extremely tough work demands. Dr. Wright would end up on the national news speaking as a subject matter expert on a subject he didn't want to be an expert in. In addition to New York, Virginia has boasted some of the highest percentages in our nursing facilities of deaths throughout the course of the COVID pandemic. As of today, there have been 840 COVID outbreaks in our long-term care facilities, 27,000 cases of COVID in long-term care out of 55,000 total in Virginia, and deaths that number 3,000 out of 6,000, it's almost 50%. 4% of our population in our Commonwealth lives in nursing homes, but over 40% of our deaths from COVID have occurred there. Here we are for the 17th year in a row talking about the same thing, hearing some of the same, but some new voices of frustrated families, caregivers, and patient advocates who speak for our most vulnerable Virginians who oftentimes cannot speak for themselves. This bill designates daytime, evening, and nighttime staffing ratios for RNs, LPNs, and CNAs, and also has a background check requirement to renew the background check after 5 years of employment, an annual training requirement for first aid, medication administration, infection control, and facility compliance. It's the same as last year's bill, those last pieces. To make this bill more amenable to the industry folks, who I know you all have heard from, who oppose this idea in this bill, we've added an enactment clause, and after discussion with the executive director of the Joint Commission on Healthcare, we know there will be a JCHC study already planned to be conducted with findings available by December 31st, 2021. Staffing ratios is not a new concept. Out of 50 states in our country, 30 have some sort of staffing ratios requirement in place, many with more strict requirements than the one proposed here. What will Virginia do to ensure we provide the quality of care our greatest generation deserves? We turn this issue into yet another work study, and I come before you again this time next year for the 18th year, asking for improved staffing for our most vulnerable Virginians. It's time to make a difference, to learn from our mistakes in Virginia, and to devote funding to make our long-term care facilities better places to finish the last years of life and to fix this inadequate staffing problem, not just continue to study it. Thank you.
Mr. Chairman. Jen, you are correct in the need to make sure that we take care of the problem that we have right now is that nursing homes cannot hire the people today. They are accepting the fines today because they can't get it during this time. And so the desire was to get it before subcommittee, and I apologize because I thought that it was generally known, I think that the chairman knew, that they could get in front of it and determine what they're going to do as far as looking at this long term. But I just think that the industry would be devastated right now if they were required in this time that they cannot find the proper people to hire more people that they can't find. So that was the reason why that there was a desire to have it go to subcommittee. And with the chairman's concurrence, there's going to be a lot of back and forth in that subcommittee, and I don't think I'm on it. But I would move that the bill be go by for the day and be sent to subcommittee so that it can be heard. I think there's a lot of people that are not on the line today because they were told that that's what it's supposed to be, and that's not exactly fair to Senator Kiggins because she thought it was. But the fact is that it was told to a lot of people that it was going to go to subcommittee. I would have it go by for the day, sir.
Motion?
So, yeah, motion.
All right, can you all hear? All right, it'll go to Senator Barker's subcommittee. And then we can ultimately see what is reported out and have a vote before the full committee at Senator Lucas's desk. We'll have to do it, everything would have to be done essentially by Tuesday in order to meet the crossover deadline. All right, okay.
Thank you, Mr. Chair. I just want to reiterate that there's a lot of voices from my side, and not being told, we lined up a lot of speakers in support who are busy medical directors and geriatricians and family members. So just to be respectful of their time, I want to thank them.
Okay. Did you have another bill?
I do. This was Senate Bill 1356. It's a clergy bill. It's about nursing home visitation. There's also a substitute for this one. And the substitute, the difference is that it just conforms the bill to CDC, CMS, and Health Department guidance, and it also...
We have to adopt the substitute.
Okay.
Is there a motion? It's been moved and seconded that we adopt the substitute. All those in favor vote on, say aye. Aye. Opposed? All right, substitutes before us. You want to explain the bill?
Yes, Mr. Chair. This simply establishes a protocol for allowing clergy visits in hospitals, nursing homes, and assisted living facilities. It's very similar to the visitation bill that was passed during our special session. This includes just so that it's in accordance with listed restrictions and guidelines, again, conforming to CDC, CMS, Health Department guidance, and also adds a telehealth provision. So visits may be virtual or audio, but it's simply an expansion of the visitation bill to allow for clergy visits.
Okay. Doesn't seem too complicated. Any questions of the patron?
Mr. Chairman.
Senator Newman.
I'm just going to speak in favor of this. I think there were a lot of hospitals that just didn't know what to do. They're good people, but they didn't understand some of the items in the Catholic faith as far as last rites, and there was just a lot of religious people that were impacted in a way that they think is not only life-changing but eternity-changing because they weren't allowed to do some of this. And so I would hope that we do this so that there's clarity on this point.
All right.
Mr. Chairman, I move to report the bill.
All right, there's a motion, and Senator Newman seconds that the Senate Bill 1356 be reported. Senator Howe, do you all need this? No. Okay, all those in favor, vote aye. Those opposed, nay.
Ayes 14, no zero.
Ayes 14, no zero. The bill is reported.
Thank you, Mr. Chair.
Okay. All right. That means that let me go back. All right, we got Senator Ruff's bill. Is Senator Ruff around? It's 1176. There he is. Senator Ruff, you're up on 1176.
Thank you, Mr. Chairman. This legislation came to me from a fellow who has been helping us with the food pantry. When he was younger, he got in trouble with drugs. He spent his time in prison, and he got out. And he realized that his calling in life was to help other people that were in his situation when he was at that age. So he actually took classes while he was working and got where he thought he needed to be. Then he contacted them, and he found out because of our laws about barrier crimes, he could not get a job helping these people. So what this bill does is say that if after 10 years, after everything has been paid, all the time has been served, parole is over, that he would be able to, or somebody in that category would be able to be considered for a job. I think you have a substitute, or should be a substitute somewhere.
All right, there's been a motion and a second to adopt the substitute. All those in favor of adopting the substitute to 1176, say aye.
Aye.
Opposed? Substitutes before us. Okay.
Mr. Chairman,
that is the bill.
Mr. Chairman.
Senator Edwards.
Yeah, we're studying barrier crimes in the Crime Commission, if you're aware of that. And I have a barrier crime bill, I believe, that would cover the waterfront.
All right. Any other? All right, bills before us.
Move to report amended.
Motion and a second to report Senate Bill 1176 it was as a substitute, with a substitute. All those in favor vote aye. Those opposed, nay.
Thank you, sorry.
Ayes 14, no zero.
Ayes 14, nay 0. The bill
Thank
is
you.
reported. All right, next is Senator Peake, Senate Bill 1235, Department of Health, certain communications are prohibited. Parker.
Thank you, Mr. Chairman. Let me get my devices pulled up. We have a substitute
All
with
right,
this bill.
is there a motion to adopt the substitute.
So moved.
Oh, it's just an amendment?
Move the amendment.
One amendment.
The amendment's been moved and seconded. All those in favor adopting the amendment, say aye.
Aye.
All right, you want to present the bill as amended, Senator Peake?
Yes, thank you, Mr. Chairman. And what we did for the amendment was we referenced Code Section 22.1, 207.1 to clarify what communications we were talking about. This bill I presented last week, and there were some questions from the health department that we were going to keep people from talking about illnesses and things like that. And this bill was brought as a result of a flyer that was sent out, and I'll discuss that flyer in a second and show you the things that were in that flyer. But this is a parental rights. It just says that before anyone can contact our children anonymously, that they have to get parents' permission. And what we refer to are family life elements, family life education elements. And so if you read the code section 22.1, 207.1b, it refers to standards of learning for comprehensive sequential family life education K through 12 shall include instruction as appropriate for the age of the student in family living and community relationships, the benefits, challenges, responsibilities, and value of marriage for men, women, children, and communities, the value of family relationships, abstinence, education, the value of postpartum sexual activity, the benefits of adoption as a positive choice of unwanted pregnancy, human sexuality, human reproduction, the prevention of human trafficking, dating violence, the characteristics of abusive relationships, steps to take to deter sexual assault, the availability of counseling and legal resources, and in the event of such sexual assault, the importance of immediate medical attention and advice, as well as law. And so that is what we're referring to, so that my bill is strictly limited to those types of communications. And what has happened is Department of Health put out these flyers to encourage third-party people to talk to children about those issues. And we say if you're going to talk to...
Say that again. They did what?
They sent out a flyer, and now I need to find that flyer, that encouraged kids to call in about sexual matters. And that's... Shoot, here's the flyer. It says, and VDH sent this out, have a question about birds and bees. Use a free and anonymous sexual health text line, free and anonymous sexual health text line for teens. And what's happened, if the teens text into that line, they are then contacted anonymously by a third-party group that's contracted with the VDH without any parental permission. Get answers about relationships, contraception, sex, pregnancy, STIs, sexuality, and more. And have questions about those. Text, talk to me, Virginia. And then they text that, and then somebody contacts them. And so these are minors, and they're not getting parental permission. And so my amendment specifically refers to these talks about sexual nature, and not health care, not pandemic questions, not outbreaks of questions that were brought up, flu, things like that. So it will not prevent Health Department from contacting these minors about health issues, but it will about sex issues.
Okay. Any questions of the patron?
Mr. Chairman, Ghazala Hashmi. Thank you, Mr. Chairman. Just a question for the patron. As I'm looking at the VDH site, it indicates that the birds and bees, Talk to Me, Virginia, the flyer that you referenced, is no longer in operation because the usage of the pilot project was not a cost-effective method to provide young people with sexual health information. So that particular company or entity and the flyer that you referenced is no longer part of VDH's plan. Is that correct?
The governor's office contacted me about the bill just 2 days ago and did not mention that. So I am not aware of that. And in any event, this bill would still make sure that if they start it back up or anything comes up in the future, that we do not contract with third parties to have conversations with our kids without parental permission. So it's still a good bill. But I have not been advised that it has been stopped.
Mr. Chairman, I move the committee amendment.
Newman.
I move the amendment.
Second.
All right, you've heard the amendment. All those in favor of adopting the amendment, say aye.
Aye.
Opposed? All right, amendment's adopted. All right, any more questions of the patron? All right. The bill is before us as amended.
Move to report as amended.
There's a motion and a second to report as amended. All those in favor vote aye. Those opposed, nay.
You still have my proxy.
I got you, yes.
Okay, good. All right.
Is that marked?
Yes, I'm a yes. Where's Suderline? Yeah.
Ayes 8, no 6.
Ayes 8, no 6. The bill is reported. All right. Good. All right. The next bill we're going to take up, since he's outside, is 1436. That's Senator Hanger's bill. Oh, he's inside.
Thank you, Mr. Chairman. Good morning, everyone, members of the committee. I have Senate Bill 1436, and what the bill does, it directs the Department of Health to establish an eligible health care provider reserve directory to collect information regarding eligible health care workers throughout the Commonwealth that might be able to assist in a health care emergency such as exists now. There is a substitute for the bill, and I would like the substitute to be adopted.
Move the substitute.
All right. Motion and a second to adopt the substitute. All those in favor say aye.
Aye.
Substitute's before us.
Thank you, Mr. Chairman, members of the committee. The substitute addresses a concern that arose with FERPA. FERPA, y'all on this committee, y'all probably more familiar with that than I am, but it's the Family Education Rights and Privacy Act. So as we're collecting this information, there's certain information that shouldn't be publicly shared, particularly with those in education, training, doctors in training in fourth year. This concept actually was developed in my office. My legislative assistant and a friend of hers in legislative services worked on this as a method of identifying people that could be called up by the governor in an emergency. The governor has that authority in an emergency, but there's no database as such. And I know Senator Barker, Senator Donovan on this committee have worked with, we have a chief data officer now, and one of the focuses there is developing data that can be helpful for various purposes. And it appeared to me that, since I had a slot to get this in, that this would be a good initiative for the health department to basically develop this database so that it would be accessible to the administration in an emergency such as we have now. Case in point, I have a niece who is a nurse who had worked here in the Richmond area. In fact, she was honored as Nurse of the Year for work she did with COVID patients here in the Richmond area last year. And then she went back to the Valley. She's got little kids, so she's kind of taken time out. But she texted me last week and she said, hey, I'm available if I'm needed anywhere to go and help with this, giving shots or whatever, I'd like to do it. But there's no mechanism formalized to do this, Mr. Chairman, and so I would suggest that this could help.
Okay. You all have heard the bill and the reason for it. Are there any questions of the patron?
Move to report as amended.
All right.
Mr. Chairman, I'm sorry.
Senator Howe.
I'm trying to read it quickly, but this is a voluntary list. You sign up voluntarily for it?
It's the information would be collected from licensed healthcare providers from records that exist. There is, I presume it would have to be if people had circumstances where they weren't able. The bill as it's written does not have an opt-out provision. That could be something that we would want to consider if somebody said, I don't want my name on a list. But as it's written, it doesn't have an opt-out provision.
Senator Howe, do you need the bill? No. All right. Okay. The motion, if it's reported, is to report and re-refer to finance. All right? So moved. It's been moved and seconded that the bill be reported and referred to finance. Okay, that's Senate Bill 1436. All those in favor, vote aye. Opposed, nay.
Yeah, okay. Yeah.
Ayes 14, no 0.
Ayes 14, no 0. The bill's reported.
Thank you, Mr. Chairman.
Thank you so much. Bye.
All right. we're going to take up Senator McPike's bill. He's out now. 1304. Senator McPike, welcome. All right, substitute's been moved. Is there a second?
Second.
All right, all those in favor of adopting the substitute to 1304, Senator McPike's bill, Community Service Board's discharge planning. All those in favor vote aye.
Aye.
Opposed? All right, the substitute's before us.
Thank you, Mr. Chairman and members of the committee. This is an agency bill and request. There was, as we're working through the stakeholder process, I had heard some, well, the framework of the bill is to help to sort of coordinate in the planning of discharge of patients, as well as the appeal period. And in the bill, it changes the appeal period to 72 hours for them to work out between CSBs and DBHDS, Mr. Chairman. There is agreement between all the parties on that. There is not agreement on the original bill as proposed in terms of the discharge period within 30 days. And so the substitute has removed that and formed a work group to look at what the key components are to the discharge process. The agency had really desired to ensure that if there are beds being occupied, that if all of the discharge planning process, but key elements were in place, that the patient would be able to discharge prior to the full plan being approved. There's still some discussions between CSBs and the agency in terms of what that is and what is appropriate and what key elements need to be in place. So that has been removed from this bill in the substitute and formed a work group to help determine sort of what the priority. And I think inevitably this committee is probably also aware part of its resources to ensure like the patient has the next step available resource to be discharged to free up additional beds. And so they're working through to identify what those key elements are, Mr. Chairman, and happy to answer any questions.
All right, you've heard the presentation. Questions of the patron? Motion and a second to report 1304 as a substitute. With, I thought we just amend. Technically, it's amendments. Okay. To report 1304 with technically with amendments. All those in favor vote aye. Those opposed.
Ayes 14, no 0.
Ayes 14, no 0. The 1304 as amended is reported.
Mr. Chairman, just before we go to the next bill, we've had a number of substitutes on bills today.
Right.
And I am not seeing them on LIS. So we're voting on stuff that we really don't see. So if we can get, IT to have the substitutes in here, it would be very helpful.
They're on it.
Mr. Chair, back here, Peak, and if I may, Senator Cosgrove, because I had a substitute on mine, and so what I found out, and they told me, if you have a substitute or an amendment, you have to tell them, give them approval ahead of time to send it out. Otherwise, they don't post it up until it's actually approved here in committee. So I would, if you're going to substitute or amend one of your bills, tell them to send it out at the time you tell them to do it. Otherwise, they won't put it up until right before, and then people don't get to review it. And I found that out this morning.
Thank you. I can't,
Then you're sitting here waiting and they don't come up.
Why would Senator Lucas tell LIS not to docket your bill?
I don't know, but last week the motion was to carry by for the day, and I have a photo of it. It was unanimous. It was a reported vote.
You want to bring it up now?
Yeah.
All right. Okay, we're going to bring this up. Well, I know, but he's here, and he said the motion was to go by for the week.
Good morning. Mr. Chairman, last week, SB 1178 was heard, and it was moved to carry it by for the day. This was the genetic counseling bill that you heard from both sides. Briefly, just to remind the committee.
Hold on.
Yeah.
The bill, it was a 7-7 vote. I remember it now.
And then it was reconsidered.
So, I can't remember if I voted on the prevailing side or not.
Mr. Chairman, I
I
think
think Senator
was
Howell
on the
voted on the prevailing
I
side,
will
but it was
vote to
already reconsidered.
All right.
Mr. Chairman, I will vote to reconsider. I was on the prevailing side to which it failed, I think.
All right, there's a motion to reconsider. Is there a
Excuse me.
second? Second. All right, all those who support reconsidering Senate Bill 1178, vote aye. Those opposed, nay. Recorded vote.
You have to give me 1 second, sir. Senator? Not on our docket. Actually, excuse me, Mr. Chair,
Yeah.
the bill went into the system, is passed by for the day, so we don't have to reconsider this. It doesn't have to be brought back up.
My understanding was it would still be before the committee. So as a 7-7 vote, go ahead, Senator.
Okay, so this is the genetic counseling licensure statute, and you heard last week about it. It has to do with what was called a conscience clause. Basically, when you go to a medical professional, you're going for accurate medical information, and we operate under the assumption that medical professionals are providing patient-centered care rather than centering the care on their own belief system. This is the only medical license that has such a clause, and it's a sensitive time for people when they go to find out if they might have Huntington's disease, genetic predisposition for that, or Tay-Sachs, or breast cancer predisposition. And you heard both sides. It doesn't. This clause conflicts with the Code of Ethics for Genetic Counselors, and the bill is supported by the Virginia Association of Genetic Counselors, former president and the board chair, as well as the ACLU and others.
Mr. Chairman,
No, you got to go ahead.
Senator Howe.
on thinking it over in the last several days, I realized that I voted incorrectly last week, so I will be changing my vote.
Mr. Chairman, is this bill, I mean, I can't get it. It's not on the docket. You can't get it.
You can go into LIS and pull up SB 1178.
So it's not on the docket, but you just go to LIS. So, all right, I'll do that.
I'm available for any questions, but we presented it last week. It's about patient-centered care, accurate medical information, and I don't believe that the passage of this bill in any way hurts the practice of genetic counseling. In fact, I think it strengthens it by aligning our standards with the Code of Ethics for Genetic Counselors.
Okay. Are there any questions of the patron?
Mr. Chairman, just a statement. Mr. Chairman, I know that we had a divided vote last time, and it may pass this time, but, I mean, there have been, to my knowledge, no complaints. There's not been any concerns about this. This is in my opinion, a way we go through the code, and if there is a deeply held religious belief or a deeply held moral belief, we're kind of exercising it out of the code. And I think that if someone has a deeply held moral conviction, I don't think I want to go to them. I would rather go to someone else, but I don't know that we should take it out of the code. So that's the reason why I'll be voting the same way as I did last time.
All right. Any other questions of the patron? All right, bill's before us. Motion and a second to report Senate Bill 1178. All right, any discussion other than what we've heard? All right, all those in favor of reporting vote aye, those opposed nay.
Ayes 11, noes 4.
Ayes 11, noes 4.
Thank you, Mr. Chairman and members of the committee.
1178 is reported. Okay. Next is Senate Bill 1237, Senator Peterson.
Thank you, Mr. President. I'll walk to the front. Mr. President, ladies and gentlemen of the committee, Mr. Chairman, actually, to be more precise, this bill deals with the quarantine statute, which is 32.1-48.010, and it deals with appeal of quarantine orders. Now, I have practiced law for 26 years. I never had occasion to read the statute. Never really had occasion to care about it. Quarantines was defined in this statute as basically the isolation of one individual who either had been exposed to his disease or had a communicable disease. And it was interesting because there were a number of rights that were attached to that individual. And the important rights is if somebody was placed under a quarantine order, they had the ability to appeal that order. And the circuit court judge that would hear that appeal actually had to go through a fairly strict process to make sure that the quarantine was being applied in the way that was most reasonable for the circumstances. And I'll actually read what the law required. It says, shall confirm a finding that such persons are appropriately subject to the order of quarantine and that quarantine is being implemented in the least restrictive environment to address the public health threat effectively, given the reasonably available information on effective control measures and the nature of the communicable disease of the public health threat. And then it goes on to confirm that all of this is basically in the least restrictive means and with respect to the rights of the person being quarantined. So that was the least restrictive means and the necessary to tie it to the public health threat and the information on publicly controlled measures. All of that was for the individual subject to the quarantine. Now the question becomes, what if a whole state becomes subject to a quarantine? How do we deal with that situation? And this came to me as I had a number of clients whose businesses were closed down. And I'll give you a specific example. A woman named Linda Park, who was an immigrant from Korea, spent her life savings opening a restaurant in Fredericksburg area. I had represented her for years, had a very successful restaurant, and it was based on having grills at the table where the patrons would sit and the food would be grilled and then they could eat. And when the rest of the restaurants were opened in May for indoor dining, hers was not. And I went to the Virginia Department of Health and said, what is the basis for keeping her closed? And I was given basically the list of reasons, and I said, well, what's the scientific basis? How is this related to the pandemic? And no information was brought forward. It was just basically presented to me as a fait accompli. And she was going to lose her life savings. So I filed a lawsuit for her. Eventually ended up before the Virginia Supreme Court. And my argument was they had to give the least restrictive means necessary in order to justify the restriction. In other words, there had to be some objective basis for the restriction. Well, the Supreme Court said she did not have standing. In other words, she was not even legally eligible to bring this complaint. Well, to make a long story short, Linda's probably going to file a bankruptcy in a few weeks when I go back and assist her with that, and she's lost her life savings. Now, that may or may not have happened. I'm not blaming anybody for that. There's thousands of people that have gone through this. But it caused me to look at this code statute and say, why do we have all these rights aggregated in one person, but if you have a region-wide or a statewide order, we don't have those rights aggregated to in that same manner? So this bill simply takes the protections that we have in 32.1-48.010 and makes that apply to an order that closes schools or businesses or restricts the movement of healthy persons within the area to which the order applies. In other words, a mass order simply carries over all the same civil liberty protections that an order does to a single person. So I give you this background because in a way you could try and sneak this through and say this is a technical amendment. This is not a technical amendment. This is a way of saying that people have civil liberties, they have civil rights, and there has to be an objective basis to take away those rights, and that's what the bill does.
All right. Any questions of the patron? Senator Newman?
I just want to make sure that we're checking to make sure no one wants to speak to it from the public. I don't know if there is or not.
Yeah. Is there anybody in the queue for this?
I didn't bring any witnesses.
There are no hands raised at the moment, Mr. Chair.
Okay. Motion report. Is there a second?
Second.
All right, the motion and a second to report Senate Bill 1237. All those in favor say aye. Vote aye. Those opposed, nay.
Can you vote me as a yes?
You're in, Senator. Ayes 14, no zero.
Ayes 14, no zero. The bill's reported. All right, next is 1307. That's Senator Donovan's. That's Department of Medical Assistance Services, School-Based Health Service, Telemedicine.
Thank you, Mr. President. Is there a substitute or an amendments on this?
Closer to the...
Yes, yes, sir. I believe there's a substitute to report.
All right. Is there a motion to adopt the substitute?
So moved.
And a second. All right. All those in favor of adopting the substitute to Senate Bill 1307, vote aye. Say aye. Opposed? All right, the substitute's before us.
Mr. Chairman, this bill works to ensure localities have more federal support for school-based services. The way that school-based services work is that localities pay 100% of those services, and then they send a cost-based appraisal or assessment to DMAS, who then takes that bill. It does not run through the managed care organizations. This is a different vehicle through DMAS. DMAS then draws down those funds at 50% ratio from the federal government and passes them through back to the locality. Virginia doesn't pay the 50% co-payment of the Medicaid expenses for school-based services. The localities do, but they front 100% and then draw down. Currently, the Virginia state plan limits the ability of schools to assess those value assessments or cost-based assessments to school-based services that are designated by an IEP alone, an individualized education plan. The federal government several years ago opened up the permissibility that schools that were offering school-based services for any Medicaid-covered child could actually bill and be reimbursed from the federal government for those services, even if they did not have an IEP, but Virginia never changed her state plan. We have to change the language in the state plan to enable this to happen. There's a couple of other components to this bill, and the amendments that you see before you in the substitute are a way to, really supported by DOE and DMAS, for us to language this better. And specifically, they work, and maybe Julia could read for me. There's a federal code that dictates what can be reimbursed. And we were attempting in the original bill to list what those services were and expand them to include applied behavioral analysis, which is for autism. But we found out that if we just reference this federal code, which describes what can be covered, we're making it much more permissible, and we're not making a mistake by inadvertently omitting a particular service. So, Julia, could you read that for me, please?
Mr. Chair, Senator Donovan, the federal code section that you are referring to is Section 1905R of the Federal Social Security Act.
And the services are EDP. Could you read that, please?
Sure. It's early and periodic screening, diagnostic, and treatment services.
Thank you, Counsel. The other component to this bill, Mr. Chairman, is that it allows schools to charge a telemedicine originating site fee. And basically, in order to provide telemedicine, you have to have approved telemedicine equipment that preserves privacy and follows HIPAA laws, et cetera. We have all the other components of really providing things like behavioral health, behavioral services or therapy, as well as mental health services, depression, whatever it is, even connecting to a pediatrician's office, except that the school cannot meet that high threshold for the materials to have the appropriate equipment. The way that everybody else in the medical community covers the cost of that equipment, is that they charge an originating site fee. And by allowing this to happen, schools who already have the permission to provide telemedicine would be able to expand those services to providers who are even outside of the school if they didn't have the resources within the school. So, Mr. Chairman, this does have a fiscal impact. Most all of the costs that I have just described, everything I've just described, is non-general fund because it all comes from the federal government. But Virginia will have to develop some guidelines for this. And one of the challenges we've had with school-based services is the quality of those school-based services, and are they actually evidence-based in their development and application? And number two, do they improve the outcomes for children? And DMAS is going to develop oversight to ensure that those two things happen so that once we do diagnose, we can get our kids to performance. We want to remove all the obstacles that they have to learning. And there are a multitude of obstacles we've addressed before because of all the other social determinants of health. And Mr. Chairman, that is the bill, and I'm happy to answer any questions. And I don't know if we have anybody to speak to it or not. I know that we have a telemedicine expert, Dr. Whibley, that has been available in the past.
Mr. Chairman. Mr. Chairman.
Senator Hatch.
Thank you, Mr. Chairman. Just a question for the patron. I've received some inquiries from private schools, particularly private day schools, and what they have commented is that the bill's inclusion of private schools is actually prohibited by federal law, so I couldn't catch in your comments whether your amendment addressed the concerns of private schools.
Mr. President, Senator Hashmi, yes, thank you very much. It does indeed strike private schools. This only applies to public schools.
Mr. Chairman, Senator Donovan, thank you. I know that there is someone online who would like to just address that. If we could just hear her testimony. It's Julian Condry from the Virginia Coalition of Private Providers Association.
Mr. Chairman, Julianne is on the line.
Mr. Chairman, members of the committee, on behalf of the Virginia Association of Independent and Specialized Education Facilities and Grafton Integrated Health has asked to be associated with these comments, that based on the statement in the FIS that DMAS does not interpret as being federally permissible under current law to reimburse private schools, we are glad that the private schools have been removed from this bill. We have additional concerns on behalf of the Virginia Association for Behavior Analysis, but the director of that association is in queue to speak to that aspect. So I think our concerns have been addressed. I'm trying to read the amendment right now.
Are there others to speak?
Next, we have Jill Hankin.
Good morning, Mr. Chairman and members of the committee. This is Jill Hankin from the Virginia Poverty Law Center. I want to thank Senator Donovan for bringing this bill. I think it's an important measure that will expand access to important medical services to Medicaid eligible kids who are in our public schools. And the telemedicine aspect of this is also quite important. We've learned a lot during COVID. That's maybe one small silver lining, is that we've learned about the benefits of telemedicine in healthcare delivery. So I think this is a very important expansion of services to low-income kids who may not have an IEP. Thank you.
Christy Ivanko, please go ahead.
Thank you.
I appreciate you allowing me to speak. I'm a licensed behavior analyst. I'm the administrative director of the Professional Association in the Commonwealth, which is the Virginia Association for Behavior Analysis. We're happy to see that SB 1307 acknowledged the importance of ABA, but we have concerns about the potential unintended consequences unless language is added to the bill that specifically states that applied behavior analysis must be provided by a licensed behavior analyst or licensed assistant behavior analyst. And this is due to an existing exemption allowing school employees to provide ABA as part of their regular duties, even if they aren't licensed, certified, or even capable. In the best interest of the student who could potentially be exposed to serious danger without protection or repercussion, and the best interest of our profession, we do not support SB 1307 without the additional language. Also want to note that licensed behavior analysts and licensed assistant behavior analysts do provide services in a variety of settings that include public and private schools, and also that we do not just treat people with autism. The science of behavior analysis does apply to everyone, not just persons with disabilities or autism.
Time's up. Thank you very much. All right.
Is Dr. Wibberley on the line?
Mr. Chair, the only member of the public with their hands raised left is Michael Assip.
Okay, we'll hear from Mr. Assip, and then we will vote.
Hello, this is Michael Asip, and I'm glad to represent the Virginia Council of Administrators of Special Education, all 400 members that support this legislation. Thank the senator for it. She is correct that there are services that can be provided in the schools. As one who has implemented Medicaid services for students with disabilities, looking outside of the IEPs for those students that still have behavioral challenges and other health needs, this is a very worthwhile cause, and I appreciate the guardrails up for quality of services and results for students. Thank you.
Thank you very much, Mr. Asip. All right, that concludes the public part of it. Are there any comments by the members of the committee? If not, we need a motion.
And re-refer to finance.
Motion to report and re-refer to finance. All those in favor vote aye. Opposed, nay.
Ayes 14, no 0.
Ayes 14, no 0. 1307 is reported and referred to finance. Okay, was there anybody here who was going to take Senator Lucas's bill dealing with cannabis products? No, so let that go by temporarily. All right. 1362, Senator Lewis, employers reporting outbreaks of COVID-19 emergency.
And Mr. Chairman, there is a substitute for this.
All right. There's been a motion and a second to adopt the substitute to 1362. All those in favor of adopting the substitute say aye. Aye. Opposed? All right, the substitute is before us.
And I apologize to the committee, to Senator Peake's earlier point. I don't think I gave the green light for that to go out, so it may not be up on the system yet, but hopefully it will be here shortly. Excuse me, I just walked up from the chamber. So Senate Bill 1362, Mr. Chairman, members of the committee, it deals with reporting requirements in the midst of the COVID-19 pandemic. I don't think it's any secret that my little corner of the world at the outset of this pandemic was the pointed end of the spear and ground zero for congregate setting outbreaks. We had two large poultry employers on the Eastern Shore who, where the virus ran through like wildfire. Our little hospital, 50-bed hospital, was under siege and fortunately was able to decompress by sending patients into Hampton Roads hospitals where there was very little outbreak at the time. What became apparent in the midst of this outbreak, Mr. Chairman, was that there was not a lot of transparency around what was going on at those facilities. The employees were incredibly anxious and incredibly concerned about their safety, as was the public at large. So after things calmed down in my neck of the woods, the Department of Labor has issued requirements regarding reporting to the health commissioner. However, there is no requirement regarding reports to the public. So what 1362 seeks to do is in situations where there is an outbreak, the substitute refers to a worksite cluster, that there are certain reporting requirements to the public that are going to have to be undertaken. Now, Mr. Chairman, I would say there are a couple of amendments I need to make to the substitute. Somehow it got lost in the translation when the substitute was being drafted that this is to apply to employers of 50 or more employees. And obviously the desire is to focus on the larger employers where the congregate settings are and the more outbreaks. So that would be a line amendment, and I'm trying to see exactly where that would go, but I'll have to leave that to council, Mr. Chairman. And the second thing is, second line amendment to the substitute, Mr. Chairman, would be little 3I regarding the number of deaths resulting from COVID-19 reported by each employer. That phrase would be stricken.
Move the amendments.
Motion and second to amend 1362, removing an amendment.
Second.
All those in favor, vote aye.
Aye.
All right.
And so finally, Mr. Chairman, the last paragraph is the meat of the substitute, and that defines a worksite cluster, and it establishes some guardrails regarding the triggering of the reporting requirement. Regarding onset of initial positive results within five or more cases with illness onset initial positive results within a 14-day period, and a likely epidemiological link between cases, and a likely epidemiological linkage is also defined in there as well, Mr. Chairman. And
let me ask you a question. So we've got, initially you had 3, now you got 5 confirmed cases. You've gone from 3 to 5?
It should have been, I think it was 5 in the original. It was 5 in the original, I thought, Mr. Chairman, maybe not.
Five in the impact statement.
Did it say 3?
It said summary had 3. It's 5, okay. All right.
And I will say, Mr. Chairman, I'm sorry, I will say, it's my understanding that this last paragraph is modeled after a similar requirement in North Carolina. And again, the idea is to put up some guardrails. But go ahead, I'm sorry, Mr. Chairman.
No, I'm fine.
Okay. And that's the bill, Mr. Chairman.
Mr. Chairman,
Senator Newman.
I don't have the substitute, so is it up now? Okay. Maybe I need to hit refresh more often. The bill that I had did have 3 in it. And
That's
if you
what
read,
I'm seeing here.
but the substitute, if it's up, then honestly, I guess I like the bill, Senator Lewis, a lot. I'm just wondering, there's no problem with HIPAA with any of this, right? You
No.
feel good about that?
And I think this was drafted with due regard to the HIPAA requirements, Senator Newman, as I understand.
Thank you, Mr. Chairman.
Mr. Chairman, behind you, yeah. I just don't understand exactly why this is needed, with great respect for the patron, but we already have the health department contact tracing and reporting clusters. And so this seems like duplicative documentation because the health department is already tracking this, especially when there's, a cluster, as they say.
Senator Donovan, Mr. Chairman, Senator Donovan, this is about reporting to the public. It's not about reporting to the health department. This is reporting to the public. Currently, these employers have to report, it's my understanding, I think they have to report they have 1 case to the health department. But there was no requirement that the health department at some point report that information to the public and make it available to the public. That's what this bill does.
Some further question, Mr. Chairman?
Senator Donovan.
So it would be publicly reported if any business has 3 or more individuals that have been diagnosed?
No, ma'am. Senator Dunn, the trigger is 5, and employees have to be 50 or greater than 50 employees. And then there also has to be a worksite cluster, as is defined in the last paragraph of the substitute. And that's 5 or more cases with illness onset and initial positive results within a 14-day period, and a likely epidemiological link between cases, and likely epidemiological linkage is defined as verification by the department that the confirmed cases were in close proximity at the same work setting for a sufficient time period, and that the timing of contact fits with the likely timing of exposure, and that it is more likely than not that the work site was the source of exposure. So what we're trying to deal with there, too, is we're trying to take into account that there can be community spread that manifests itself in the workplace. So that's what that language is trying to take into account. There has to be some evidence and determination that the work site was the source of the infection.
Mr. Chairman,
Senator Donovan.
just to comment on the bill, I have anxiety about this because I have seen how the public has processed information about COVID. And I think it's extraordinarily hard to necessarily establish with confidence where COVID was contracted. Contact tracing seeks to try and establish that, but it's gray. Furthermore, the health department is navigating specific interventions to ensure that once that cluster is identified, there's no longer the risk at that business because they've quarantined everybody that's exposed. But you're exposing businesses to the anxiety that we've seen in the public who are having trouble processing data and information based on the way it's been received without necessarily having any net benefit to the community because the health department is already intervening to quarantine all the individuals. So I think this is better handled in the hands of our epidemiologists in Virginia, and that we shouldn't be making this publicly reported unless the health department thinks it's appropriate to do so. It's different with nursing homes. It was different with the reporting in nursing homes, but I have, for all of those reasons, I'm not going to be able to support this, and I hope we'll give this serious consideration because really subject matter experts should be reviewing epidemiological data and making a decision when the public needs to be notified, and we shouldn't be codifying it.
All right, so also the substitute's taken the work site, which the initial bill was 30, is up to 50 now.
The line amendment we adopted to the substitute did that. Yes, sir.
Okay, all right, the bill is before us. Any further questions? All right, is there a motion?
Mr. Chairman, I'm going to move to report the bill and refer. Yeah, sorry.
Second.
Finance need this? All right, so the motion will be to report and refer to finance. All those in favor of reporting and referring to finance, vote aye. And okay, those opposed, no.
Thank you, Mr. Chairman. Thank the committee.
Looking for the number again. 1360.
Ayes 12, noes 3.
That's what was delaying me. 13. All right. Bill 1362 as a substitute and amended. The substitute was amended. Has been reported and referred to finance. Okay, that takes care of Senator Lewis. All right. We got Senator Newman's bill, and that is the Drug Control Act, Schedule 1, reported. All right, Senator Newman.
Mr. Chairman, can I do it from here? Mr. Chairman, this is the annual bill that we have every year to update what are the chemicals that are in the spice bill. Delegate Garrett did this many years. The crafty people on the other side end up coming up with slightly different compounds, and we do this every year, and so that's what the bill does.
Move to report, Mr. Chairman.
Okay, doesn't seem to be any controversy here. All right, you've heard the bill. It's a mere administrative type procedure. Senate Bill 1464 is before us. There's been a motion to report. Is there a second? All right. It's been moved and seconded that 1464 be reported. All those in favor, vote aye. Those opposed, nay.
Ayes 15, no zero.
Ayes 15, no zero. The bill is reported. By my recollection, the only bill left is Senator Lucas's 1333.
Mr. Chairman?
Anybody want to take that? Yeah.
Well, I did want to point out that 1303 is still in the committee from last week, and that, like Senator Evans' bill, failed 7-7, and I'd like us to reconsider Senate Bill 1303 again today.
What did 1303 do?
1303 is a bill that requires school boards to provide both virtual and in-person education.
I'll second the motion.
All right, it's been moved and seconded that what was the vote on that?
7-7.
7-7. Can't hear you. All right, yeah. All right. The bill was technically really still before us as a result of the fact that it was a 7-7 tie.
Mr. Chair,
Senator Peterson, wasn't that your bill?
if I might, well, it's Senator Donovan's bill, but I support it. But I do think that no matter where you stand on this issue, and I understand we're all gathering information, I'm actually going to speak later today on this, I hope we at least pass this and send it to Finance and make this part of the conversation in the Finance Committee. So I believe in-person education is very critical for children. That should be self-evident. But I hope we at least pass this bill and send it to Finance and make it a part of the budget discussion.
Mr. Chairman, I'm questioning why it would need to go to Finance.
I can't hear you.
I'm just wondering why it would need to go to Finance, because we already fund schools.
All right, well, in that case, I withdraw that.
And it hasn't been tagged for Finance before, but...
All right, the bill was 7-7 before. All right, there's been a motion and a second to report 1303. All those in favor vote aye. Those opposed vote no.
Ayes 8, no 7.
Ayes 8, no 7. The bill is reported. Does anyone here want to take up Senator Lucas's bill?
That's a somewhat complicated bill.
Mr. Chairman, I think those bills are across the hall in a special subcommittee. Marijuana.
1333.
Is it marijuana?
I must have put it somewhere.
Yeah, it's not.
Mr. Chairman, if I have a minute, I don't know, if it's not in this committee, we don't need to present it, but I am co-patron and I can speak to what the bill does.
I can't hear you.
I am a co-patron on this bill and I can speak to it. I'm probably not as eloquently as Senator Lucas, who's done more research. But if it's not in this committee anyway, it
is.
Okay. Right. I'm scanning the bill to make sure I'm not omitting anything, Mr. Chairman, but basically what this bill does is that it allows what is commonly called flower to be part of the components of medically managed pharmaceutical grade marijuana cannabis products in Virginia. And the reason that is important is that it is vastly less expensive than the products that are derivatives that we are now compounding. And number two, it provides us the opportunity to transition a large number in the population from what is currently illegal marijuana use that they are buying without any pharmaceutical oversight to something that is overseen by pharmacies. And I can give personal examples of this as I take care of, I cannot tell you how many pregnant women who are using and smoking cannabis, and they are buying it on the street, and they don't know exactly what they're getting. There are very different side effects depending upon which kind of plant that you get. And I would prefer them to not be smoking. That's very bad for the baby, and I would very much like there to be a medical equivalent that I could transition them to that would be much safer for them in pregnancy. So from a medical perspective, this is just for the 5 pharmacies, 4 that are open or about to open, and 1 whose license is still pending. And that, I believe, is the bill, Mr. Chairman.
Mr. Chairman, there's someone to speak on it.
Mr. Chair, really quickly before we go on, there is a substitute to this bill that Senator Lucas approved. We are sending it to LIS now, and I'm happy to run through the substantive changes that are in the substitute, if that would be all right.
That would be fine.
Okay. So there's just a few minor substantive differences. First, the substitute requires that pharmacists consider all cannabis products dispensed to a patient when determining an appropriate supply of botanical cannabis. Next, the substitute pushes back the new regulation implementation date from July of this year to September of this year. And then finally, the substitute increases the Board of Pharmacy one-time botanical cannabis fee from $50,000 to $75,000. That's a fee that the pharmaceutical processors will pay to the Board of Pharmacy.
Okay. All right.
Mr. Chairman, first we have Alexander McCauley to speak on the bill.
Okay. All right. Welcome, Mr. McCauley. Give us about no more than 1 minute of your time.
Thank you, Mr. Chairman. Alexander McCauley on behalf of the Virginia Medical Cannabis Coalition. We appreciate Senator Lucas bringing this bill forward, and wanted you to know that while the administration doesn't have a position on this, we did work with them on several amendments, and those discussions are ongoing. As you know, Mr. Chairman, Virginia's medical program was set up 3 years ago, but the providers are currently restricted to oil products. This restriction is a significant problem because flower products are very helpful. They have very good medical qualities, and they're far more affordable than the oil. And I think it's very worth noting that 32 of the 36 states that have medical cannabis programs allow those programs to dispense flower products. Just a few quick highlights, Mr. Chairman, on the bill. On page 6 of the substitute, there are definitions for botanical cannabis, usable cannabis, and cannabis products. On page 10, the bill addresses how flower products will be tested for safety. On the last page, there's a special fee that the medical cannabis companies will pay to cover the costs of the implementation of flower. And a final point is that we see this as a social equity issue. Cannabis oil products are expensive, and these patients are having to pay $200 for their medical card. Then they have to pay a fee to the Board of Pharmacy, and then they have to pay for the actual product, which is not reimbursable by insurance. So passing this bill will make this product, this medicine, far more available. Thank you, Mr. Chairman. I would respectfully request that you recognize Ms. Nigist Abibi, who's with the Virginia Medical Cannabis Coalition and can go into further detail.
Ms. Abibi, please go ahead.
Got 48 seconds.
Got it. Thanks for the timer. Good morning, Senators. I just want to echo what my colleague Alexander just raised. My name is Nigis Debebi, and I'm the Director of Public Columbia Care and speaking on behalf of the Virginia Medical Cannabis Coalition in support of this bill. I will just echo one, that this improves safety in terms of having access to reliable products that have been tested and tracked. To Senator Donovan's point around the challenges for folks who are participating in the illicit market in search of affordable medication. Also recognize that these botanical products are 30 to 50% more affordable than the more processed and oil-derived products. And given that no part of this program is reimbursable by insurance, it's important to have this affordability. Thank you for your time this morning.
Okay, thank you. All right. We've heard everything. Is there a motion?
Move to report.
And refer to finance.
Motion to report and refer to finance. All those in favor vote aye. Opposed, nay.
Ayes 12, noes 1, abstentions 1.
I think she would have voted for her own bill. All right. That, I believe, completes the docket.
All right.
So is there any more business to come before the committee? If not, the committee will rise.